Dr. Todd Dorfman is the Chief Medical Officer and Hormone Management Specialist at Rebalance Health. Together with his team, they recently launched an affordable, natural solution to balancing hormones and cortisol levels called the Rebalance Hot Flash System. Hormone replacement therapy is usually the first recommended treatment option for menopause symptoms, but now there's a proven natural alternative. Through Rebalance's published clinical study, Dr. Dorfman proved that 100% of women participants experienced an 80% reduction in hot flashes, as well as relief of other common menopausal symptoms in a safe, natural way. Dr. Dorfman, welcome to the show.
Thank you for having me.
Okay, we are very excited to have you here. I have a lot of questions.
Okay.
So at what age do you find that women begin to experience those menopausal symptoms?
Well, it's a bit different for every woman.
Sure.
Generally speaking, it's between age 40 and 45.
Okay.
There's some women who don't hit menopause till 50s,
Oh, wow.
mid 50s even. And menopause is a little bit tricky because there's this concept of perimenopause where
Yes.
you start to get irregular cycles. Some of the hormones become imbalanced even before you have true menopause, which by definition means you haven't had a menstrual cycle in a year. But
Okay.
well before that, there are some hormone imbalances that usually I address with women in my practice.
Interesting. Okay, so can you tell us about your studies on the hot flash system?
Sure. Yeah, it's a really exciting study because it was done through an independent review board, so a third-party review board.
Okay.
So it wasn't just an in-house product. We
Sure.
had people overseeing this, and it was also accepted in several journals, which are peer-reviewed journals. So
Okay.
other people, believe other scientists and physicians believe in the study.
Hmm.
We took 104 menopausal women with hot flashes, essentially, who
Okay.
were not being treated in any other way, and we gave them the product. And in as soon as a couple days, some women reported that they were having symptom reduction of hot flashes. About 30% of the women got reduction in a short period of time, just about 2 weeks or so.
Okay.
We carried the study out 90 days, and 100% of the women reduced hot flash symptoms by, on average, 80%. It was really a tremendous study.
That's huge.
It's huge, yeah. In addition, and something we didn't expect, is that almost 100% of the women, again, they obtained some other benefit, like they slept for a longer period of time, they had higher quality of sleep,
Okay.
less irritability, more energy throughout the day, better moods, better libido, better sexual function. All of those things were sort of not necessarily expected, but they were proven in the study. I think it's truly unique for a couple different reasons. We put together a combination of traditional Indian natural products and
Okay.
herbs with traditional Chinese natural products and herbs. So that's Ayurvedic medicine is the Indian type medicine. And there are a number of studies on things like ashwagandha, which is one
Yeah.
of our ingredients to reduce anxiety, reduce stress, to help people sleep better. Those are very good studies that are done mostly in India in their science. And we then, once we developed the ingredients we want in the product, we use a unique type of delivery system, it's called. So you don't swallow it like a pill, you don't
Okay.
chew it like a gummy. It's a lozenge, and you take a lozenge 3 times a day, and it
Wow.
dissolves in your mouth. And then we showed that you get a much better blood level.
Sure.
It's about 300% higher blood
Oh,
level.
wow.
It gets into your system about 75% faster than leading product.
Okay.
So I think it's truly unique, and it's non-hormonal.
So how quickly can customers start to see a difference after they're taking the hot flash system?
Well, we've had several reports of patients not necessarily in the study that had relief of certain symptoms within a couple of days of taking it.
Wow.
In our study, we had time intervals every 2 weeks where we checked in with the patients.
Hmm.
So the soonest we recognized in the study was at that 2 week point, but about 30% of women had significant relief of the hot flashes within 2 weeks. The
Okay.
further out we went, the longer you take the product, the better it works. So we went out to 90 days, and that's where 100% of the women had really an 80% reduction in their hot flashes.
So what do you love about this system?
Well, when people ask me why I think the system works so well, one of the best things about it is the delivery mechanism. It's a lozenge that you take 3 times a day, and we've shown that by delivering our ingredients via the lozenge mechanism, we reach a blood level 75% faster than the leading product. It lasts 33% longer, and we get 3 times the absorption compared to a leading product of either a gummy or a pill when we tested it.
That is amazing. This
Yeah.
was very informative. Thank you so much for being with us.
You are very welcome. It's great to be here.
All right, you guys, we'll be right back.